Hey guys, it's your girl back again. And yes, I am Hey It's Aurora, that girl who likes to cosplay. And the title states it up above or, yes, down below. I am a chronic pain patient. I have been that for 5 years now. And this roller coaster has been horrible. And with this whole roller coaster and everything, I just want to give the backstory on why I am doing this. So I'm a little nervous to come out, guys, and say this because many people have predispositions to opioids. Many people feel that opioids are bad and it's just bad, okay, when really I have had success on this medication. If it wasn't for this medication, no joke, guys, I probably would have committed suicide 5 years ago. No joke. Because my pain level was getting to the point where I was falling at work by Wednesday. By Friday, I could barely even get up out of bed. It wasn't equaling up. I had to miss days off of work. Lo and behold, I was diagnosed with myofascial pain syndrome, where your muscles swell underneath your skin. Horrible thing. It is really painful, and fibromyalgia, which is nerves, both of which you cannot see but are very crippling and debilitating. And where people don't often see what I have here with me is, of course, I have grabbers. I have tried numerous creams. One of my creams behind here is a Tylenol pain relief balm. I have tried copious amounts of, what do we got here? Rubs. We have advanced therapy rubs for minor aches and pains and scrapes and burns. We have numerous things that I have tried, guys, as a chronic pain patient. And I have tried acupuncture. I have also tried chiropractic. Both didn't work for me. So when I mean opioids helped me out, and I'm a big advocate for opioids for chronic pain patients, I am humongous in them. They have given me back my life. I wouldn't be sitting talking to you guys upright right now doing 2 live streams if it wasn't for the opioids I was given the allotment. So when I see programs like Dr. Phil talking about this and not showing the success rates that people as chronic pain patients have, and yes, there are success stories. And for you guys personally, my allotment is to take one tablet 12 to 24 hours as needed for pain. And what do I do? This is where people are going to be taboo on this. I have to cut it up because I can't take the full allotment because it makes me sick. So I cut mine into a quarter piece. This is a half. I also cut this into a quarter, which I'll show that to you right now what that quarter will look like. Yeah. I understand what people are saying when it comes to addiction. But what Dr. Phil is not adding into these programs, and what I have heard no one talk about besides a CBC, British interview, who actually interviewed a chronic pain patient. A lot of people don't know this, that for chronic pain patients, guys, about 3 to 5% of us will get addicted to our medicines because we don't want addiction. Why? Addiction equals more pain. This medication does have reverberating pain, which means you will get some pain afterwards when you stop using it, but once you pan out, you should be fine. When I see these issues, people have so much hatred for this medication, wanting to condemn it. They don't want to look at the positive attributes. But it's people like this who are addicted. There is a psychological component that I hope to God Dr. Phil talked about. Because most people will say, oh, you take opioids, you're addicted. No, you can have a chemical dependency, which means your body is used to the chemical presence in your body. When that chemical presence is no longer there, the body is going to hurt a little bit extra. It's going to feel funny until you get past that process. It's like a detox process. But for someone who is not addicted, they're not going to have that craving, meaning, oh, I want that to get high. I want it to get high. And what I hope to God Dr. Phil did talk about is that most chronic pain patients who take opioids, who are true chronic pain patients, will not feel any high. I do not get high from the medication. If I have too much of it, I get sick. That's my stomach. But I see these TV shows, and they only address one thing, and that is the addiction itself. This has the classic case of, oh, this poor chronic pain patient who has stomach issues got hooked to her meds. But I'm listening to her, and some of the stuff she's saying is not equaling out to what a chronic pain patient would normally say and normally do. 3 to 5% of us, and possibly lower, get addicted to our meds. We don't feel high from this medication because it helps us. It allows me to sit up, do light housework for about 6 hours of the day, and then that's it. And then I suffer for the most part afterwards. If I go too much or too long, I hurt. Meaning that my chronic pain, because of the myofascial pain, if I'm constantly out, like I'm constantly sitting right now, it hurts. From doing a repetitive movement, such as sitting, walking, running, lifting, all that stuff, repetitive movement will worsen my condition. So that's why I need this medication to function. It gives me a break to where you don't suffer every day. But then I see people like this, and this just irks me to no end, that there is success to this medication. But Dr. Phil, I expect you to see other half of my people. And guys, my people, chronic pain patients, are dying in the street because once they were treating us with opioids, they stopped it cold turkey, and then patients ran and flocked to the streets for heroin to try to stop their pain. And they were also trying to go to the streets for pills. And those were laced with fentanyl. Fentanyl is a horrible painkiller that is scientifically man-made, where opioids is a derivative of the poppy seed. Little do you know. So that is a horrible drug in itself, that fentanyl. But this condemns the chronic pain patients, condemns those who have success with it, because Dr. Phil and no other dang program is going to say opioids saved my life. She did say this, that the opioids saved her life. But now she didn't watch the medication, and frankly, she has a psychological component that that I think the doctor clued in on. Dr. Phil did. I picked up on it too. Yeah, let's get in on this one.
My mom is highly addicted to painkillers, and it's going to kill her.
Man right now. My mother-in-law is so high on pain medication that when I'm talking to her, I don't feel like she really understands what I'm even saying.
Ativan's not a pain med.
I've known Nathan and his family my entire life. Helen was very functional. She was on top of her game.
About 15 years ago when I was in middle school, my mom had gastric bypass surgery. Since my mom's surgery, pain pills have been part of her life. Things started falling apart quickly. She lost her job. She lost her...
Okay. So the first thing I'm going to point out here, she was not a chronic pain patient before. She went in for a surgery. Pain pills were made for acute cases, for acute pain. They do find that with chronic pain patients, they, it can harm them over time. But I've been on them for 5 years, I have never had an issue to where I have upped my dose, to where I've gone over a pill a day to 2 pills a day. I have never done that. I look at this medication as life-changing medicine. This is life-giving medicine for me. It's not freely, woohoo, as candy. So, this was acute. And when you get acute, you get the high feeling. That is number one I'm going to say. When you are not a chronic pain patient, you get hooked because you get that high feeling, that acute pain, and then you get the high feeling because it's not what you need in that direct time. Then, I heard someone say on a YouTube page that, oh, I'm Southern. We save our pain meds till after the wound heals. You know what I mean? Why is that? You don't have pain. You get high from the medication. That is why some people will say, I'll save my medicine until after my surgery. That is a big no-no. You're using the medication wrong. Ping 1. Americans need to get this. I want to get high out of my head. This is not okay.
their house.
The house was a free-for-all. Helen just really didn't care.
When I was in high school, my mom took me to school in the morning, and she drove over curbs and into the yard at the high school, and I quickly realized that she was high.
I remember one time, Helen almost got hit by a car because someone was trying to steal her pain medication.
I moved out at 15. Enough was enough. I went away to college. I started my career. For about 8 to 10 years, I had very little contact with my mom and my sister. I just didn't want to get caught up in the drama. About 5 years ago, I reconnected with my mom. She was a mess. She was in a bad spot. My mom would do anything to get pain medication.
I didn't take any out of there yesterday. Yes, you did. No, I didn't. She will go out on the streets and find anyone that has pills.
My mom has been known to be jumping from pain doctor to pain doctor, from hospitals to hospitals to get what she...
Okay, that's number one. Chronic pain patients, guys, aka me, we do not doctor shop. We get accused of doctor shopping way too much. That's number one for her being an addict. I'm already picking up on 2 pings that I don't think people with this subject, with this medication who use it are going to pick up on. Number one, she was acute. She had a stomach surgery. She got hooked. She liked the feeling too much. You didn't look at it as medicine. You got hooked. Now you are going into the streets, and I'm sorry, she's doctor shopping. What does that mean? That means you go to different doctors only for, not the treatment itself, just to get medicine. They always ping chronic pain patients with this. But what they don't understand, guys, is that where I'm from, with how tight this is in America, especially in California, this medication, I need to go to a specific doctor, specific place, one that has my record, one that has everything on file, and where the inhumane treatment comes for us is that we are subjected to random pill counts to make sure that we are taking the medication as needed, that we are subjected to random piss tests to make sure that we are not taking any shrooms, any drugs off the street, and also to see how high our metabolism processes the medications, yada yada, this and that. We get pinged for that. Number 3 of the long list of these jurisdictions, if you have mental medication, if you're bipolar, you also have to get your psych to sign off on this. I have mine already signed off. There's multiple things that you have to do to get this medication, and what this woman is doing is hopping from doctor to doctor to doctor. Pinging number 2. She has a psychological addiction to this, too, as well.
She wanted.
Can't be very much privacy in a hospital.
Last time I was in the hospital, the doctors put her on a morphine drip. I truly believe that she has hurt herself falling downstairs on purpose and done things on purpose to have to go to the hospital to get something. My mom...
And I've heard that too, where drug addicts will hurt themselves on purpose to get what they want, the pain meds and stuff. I have never done that. I don't know any chronic pain patient who would ever hurt themselves intentionally, because why? As chronic pain patients, we hurt every day. Extra pain? No, thank you. You want to tell me, oh, I'm not giving you your pain meds? I'm going to think to myself, okay, I'm going to go through withdrawals. I have other medicines that can help with this, and I'll get past it. And I've done that very recently. It was fine. I was sick for 6 days. That's all I looked up. Stomach issues, that's it. No throwing up, headache, yes, that's it. 4 days of a fever, and then by day 6, I was fine. But it was a quick taper. I had to taper. That's what you have to do properly. So, already, this woman is not a chronic pain patient for the reasons I just stated. She was acute. She took it, got hooked. Like I said, you're a chronic pain patient. You don't get hooked from this med. You don't even get high from it. She did. Number 2, she's doctor shopping. Constant staple of an addict. We can't, as chronic pain patients, doctor shop. It's in the contract that we signed to get the pills. We can't doctor shop. They'll track you. You can't. And then number 3, she's hurting herself. Ow. As I'm talking to you, my back is like right now. A real chronic pain patient would never hurt themselves. Why? Like I said, ow. When I think about that, that means extra pain. And then if we, knowing chronic pain patients, we go in with that already listed, you fell? Oh, you're faking it. Go away. Oh, just here, take an aspirin. Here you go. They don't even treat us. Because why? Chronic pain listed in the thing. This woman, classic case. She is not a chronic pain patient. Thumbs up. This is not a chronic pain patient case. I'm
She's
calling it.
dying from complications from her gastric bypass, but she's dying from the painkillers and the drugs. That's what's killing her. If we don't get my mom on pain medication immediately, I know, my fear, and I know that my mom will be dead.
You rode in, correct?
Yes, me and my wife did.
Why now?
Because one of our family members was struck by a car, and we were at the hospital to be there for him, and my mom showed up very high. And it's probably one of the worst times I've ever seen her.
What does she say about it when you talk to her about it?
She denies it. She blames everything on her medical conditions and that she's in pain and it's a medical problem. It's the doctors that is the reason why she's not the mom she used to be.
Have you just called her out on it? Have you refused to support her in any way in getting these drugs, doing these things?
Yes, I've done that my whole life.
Good.
When I moved out at 15, I separated myself from my family completely.
Good. Rule number one. I know chronic pain patients, guys, it gets very scary for anyone who has this medication to look in the bottom of it and go, oh shit, you don't have it. It gets scary and your heart drops. You get anxiety upon anxiety, and it's like, what to do? Well, then you have to stop and prepare. You got Tylenol, you got creams, you got different things that you can interact with. Wow, yeah, no. This is condemning the patient. I hope that Dr. Phil really, in all honesty, like they're pinging so much stuff here on this program, such as, it saved my life. Even this woman said it. It saved my life too. But I'm on the same dose since I started a year ago. And I am so heavily monitored. I have not changed my dose. She has. Wow.
Take to accept those behaviors.
You say your sisters, Alex and Demetria, are not doing enough to get your mom the help to get off these pills.
My sister Alex was supporting me 100% at that time. Demetria was not. Demetria was being nasty to us, telling my mom she didn't need to go to rehab. She didn't need to do things that I said that she needs to do.
Did you realize that she is actually harming herself so she can get pain pills? In 2010, she throws herself down the stairs so she has injury.
Wow, and they just show her long list here. My list is not like that, honey. And every time I fall and I have to go to the ER, I don't get pain meds because why? They see it already in my chart and they're like, you have it. Go ahead, have fun. Where is she getting this? What? Where are you getting your shit?
So she can present herself to an ER. In 2011, she started befriending addicts at AA to get pills. 2011 through 2016, she's in the hospital a lot, so she's getting...
And they have, I already see one thing on there already, that a chronic that I have taken and I had a bad reaction to. It did not work for my pain at all. Tramadol! Oh, yep, that's one on the list of medications that failed me. Tramadol in 2013 at hospital, arrested for drug seeking. Girlfriend disappeared to find pills. Yeah, no, this is not a chronic pain patient by any stretch of the imagination. This is an addict. This is a normal person who got hooked. I'm pissed. This is the reason why we as chronic pain patients are committing suicide, is because of fucktards like this.
Times a year.
Could be more.
She stole $40 from you, which she's using to buy pills.
Yep. That's not my mom. My mom taught me, none of these pictures in here, my mom taught me a lot.
But you see her wasting away.
Yeah.
Does that hurt you?
Yeah. My mom was a hardworking woman. I remember seeing her get up every morning early, get dressed, professional, look good, ready to go. She took care of an addict for years. She took care of an addict for a long time. And then when she left him finally, because us kids were just gone, she turned her page in life and thought that she could go out and stuff and have a good time, and she was lost it. And then she had a gastric bypass because she wanted to.
Okay. I've heard enough. I can already make, hey there, chocolate ice. I can already make a determination on this episode based on what I've seen. Okay? This woman, as I stated numerous times in this live stream, this is hurting the chronic pain patient. They're only giving another drug, another addict light. They're not even giving chronic pain patients a chance in this. This is condemning the success that anyone has had on this medication. If you guys go to one of these things. You're going to see my face with a comment under the video like this is condemning it. They are ruining any form of treatment for us by showing idiots like this. And guys, I don't want to call her an idiot. This woman has had trauma in her life that obviously she needs to get addressed. But the pain pills, they are not for you. No. No, you were acute and you like the feeling, you got hooked. There's a psychological component to addiction that not a lot of chronic pain patients have. And I have to say this now, guys. Addiction, you have to have a psychological component, meaning you're spending more time with the drug than you are with your friends, family, work, etc., etc. Your whole entire money and finances has gone to that drug. It's ruined your life, and all you think about 24/7 is that medication, is that next fix. A chronic pain patient normally does not have that. And I have to address this now. Many people say, well, you take it and then you have withdrawal, therefore you're addicted. No, there's a difference, like I said, between chemical dependency and addiction. The addiction has all those things I've listed out, such as hurting yourself like she's doing, doctor shopping, let me see, what else? Spending more time with the drug than her family, making dangerous decisions to get the drug. All this type of things where chronic pain patients, the desire not to withdraw or to feel the effects of withdrawal does not make the component for addiction. That's all I'm going to say. It pisses me off that you will never hear in America opioids saved my life from a chronic pain patient because they never do that. I'm here to tell you guys opioids saved my life. I've been on the same dang allotment for 5 years now. And I have been able to get up from this bed and walk. It's amazing. But if I didn't have the Percocet that I cut, mind you, into my quarter in pieces, like I said, I'm fighting for this, guys. That's my allotment. This is what I do with my med. No other addict is going to do this with their pills like a chronic pain patient will. No one. No one. Because it is a life-giving medication. And as I state this now, guys, I have to say this now. The cap in America is 28% for chronic pain patients. They want to make it up to 40%. To meaning to where 40% to where that is the cap. That means less pain meds to go around. And if you really want to get technical, the United States is the biggest consumer of opiates. And right now, in other parts of the country, there are people dying in stage 4 cancer, moaning 24/7 with no pain meds. Is that nice? No. She was an acute case. Pancreatitis, had something happen, boom, 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 boom. I'm seeing all the classic signs. But if you're a real chronic pain patient, you will not. There's a 3 to 5% chance that we're going to get addicted. We don't feel the high. I don't get this. And Dr. Phil, shame on you. You brought an addict to play into the opioid scare when my people are dying, committing suicide because there's no hope in this medication for us because people like this and the programs push it. 2 of my friends on the forums that I am on for chronic pain they have died. One killed themselves by hanging. The other one shot herself in the head. And this kind of shit that Dr. Phil, you had better give another better example of a chronic pain patient than this. This is a fucking addict, you asshole, you fucking bald-headed hillbilly. No. What are you doing? You're getting views. Ching ching, I can see it. You're not helping anything. You're making my people suffer worse. Horrible. 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 For shame. For butt fucking shame. I expect Dr. Phil to give a better example than this. And to really talk to a chronic pain patient in their bed. Unable to get up, Dr. Phil, because we don't have the opiates. Because you show stupids like this. DNA also plays into a big component, guys, with addiction and opiates. Your DNA plays a big part. But by only showing the side of the opioid scare without the chronic pain patient in it, you're closing us, you're condemning the patient, you're condemning our medicine that has helped us. How dare you? How dare you, Dr. Phil? How dare you? I can go on and on and on, guys. I'm a chronic pain patient who is for opioids. I am for it. It saved my life. I was on a bridge 5 years ago about to jump because of chronic pain. Because I didn't get it. And even after I didn't jump and seek help for wanting to committing suicide because of chronic pain, they still didn't give me the medication. What did I do? I said, I am not going to live my life in pain like how you want me. I'm not going to commit suicide because that's illegal. I want death with dignity, and I want it today. I would like I already gave my first request. And that's when my doctor truly looked at me and said, what do you say? Yeah. I'm telling you, I'm not going to live my life in pain. And pain is not meant to be lived every single day. When people say, take an aspirin, I've taken boatloads. It don't help for my pain. I've taken Tylenol. The rubs, the balms, the Tylenol balms, they only last 15 minutes at the max on my knots. I can't even do dry needling or acupuncture because of how bad it hurts. It's bad. And to see this, just to see Dr. Phil play into the scare of more opiates, more this, more that, blah, 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 blah. You're condemning it. You're condemning us. Fuck you, Dr. Phil. You had better give a better example of a chronic pain patient who has had success on this drug. I want to see it, fucker, because I ain't seeing dick from your constituents, from Opal, from Hopeful, from Oprah, from MSNBC, from CNN, from Fox News. No one wants to hear opioids save my life because why? You're all taking away your sedatives and your whatever it is, booze. Fuck you. My people are dying in the street, and normal people don't want to hear this. Yeah, well, keep on condemning. When you die, when you're in your last stages of life, you're going to want that pain med. Guarantee. But if you keep on going how strict you're making it, guarantee when you're laying there ready to die, you don't got no pain med. Good luck. Sick. Sick, sick, sick. 3 to 5% of chronic pain patients, true chronic pain patients, get addicted. This bitch ain't one of them. This is a normal person who got hooked. Classic. Classic into the scare. Fuck you, Dr. Phil. You're an ass. I'm done.